Early cancer screening saves lives. It offers a window of opportunity to detect disease before symptoms appear, when tumors are smaller, more treatable, and in many cases, curable. But for millions of obese individuals, that window remains shut. Despite being at significantly higher risk for a range of cancers, obese patients are often less likely to receive timely screening. This disconnect isn't just a public health oversight. It's a systemic failure that reflects stigma, inequality, and a healthcare system that continues to miss one of its most vulnerable targets. Obesity is linked to at least 13 types of cancer, including breast, colon, endometrial, pancreatic, and liver cancers, many of which are highly lethal when detected late. And yet, studies consistently show that individuals with obesity are underscreened compared to those with lower body weight. This is not because the medical community is unaware of the risk. It's because the pathways to screening, supposedly routine, supposedly accessible, are riddled with barriers that disproportionately exclude people living in larger bodies. One of the most insidious barriers is stigma. Many obese individuals delay or avoid medical visits altogether due to prior experiences of weight-based bias or judgment from healthcare providers. Being lectured about weight during unrelated exams, being dismissed when reporting symptoms, or facing insensitive comments during routine care creates deep mistrust. For these patients, doctor visits can feel more like moral trials than medical assessments. That avoidance, understandably, extends to screenings, even life-saving ones. There are also physical and logistical barriers. Standard equipment used in screenings, such as mammogram machines, imaging tables, or colonoscopy scopes, is often not designed for higher-weight patients. This lack of accommodation not only makes procedures uncomfortable or humiliating, but sometimes leads to cancellations or outright denials of care. When people are turned away or made to feel like an inconvenience, they're far less likely to return. Then there are the gaps in insurance coverage. Obese individuals, particularly those from low-income backgrounds, are more likely to be underinsured or uninsured altogether. Preventive services may not be covered or may come with high out-of-pocket costs. For people juggling housing insecurity, multiple jobs, or chronic illness, routine screening becomes a luxury, pushed aside until symptoms force them into emergency care, often when the cancer is already advanced. But perhaps most troubling is clinical oversight. Even with guidelines recommending earlier or more frequent screening in high-risk populations, many healthcare providers don't adjust their protocols for obese patients. Cancer risk is often treated as a numbers game based on age, family history, or race, but obesity, despite being a major risk factor, is frequently omitted from the risk equation. This failure to act on well-established science is inexcusable. The result? Cancers that could have been detected early are caught too late. Treatment becomes more invasive, survival rates plummet, and healthcare costs skyrocket. And all of this was preventable. The irony is bitter. The very individuals who would benefit most from early screening are the ones least likely to receive it. This isn't just a missed opportunity, it's a public health crisis disguised as a clinical inconvenience. To fix it, we must first confront the bias in our healthcare system. Not just personal bias from providers, but institutional design that excludes obese individuals from full participation in preventive care. That means training clinicians to recognize and combat weight stigma, redesigning equipment and spaces to be accessible, expanding insurance coverage to remove financial obstacles, and revising screening guidelines to reflect the realities of obesity-related cancer risk. Failing to screen high-risk populations is not a neutral act, it's a choice with deadly consequences. Until we recognize obese individuals as a medically underserved population, deserving of dignity, tailored care, and proactive protection, we will continue to watch cancers rise in silence, undetected, untreated, and unforgivably ignored.